Hi guys, my name is Dr. Sammy Gibson and I'm over here at Eastwood Animal Clinic in El Paso. Today we're talking about some of the questions that we get asked on a routine basis for the most part. One of the biggest ones I get with a happy, healthy patient is my dog fat? What should I be feeding my dog? What's going on? And tough question to answer sometimes because we get little chihuahuas and we get these big Great Danes and everything in between. So we have a good time and we get to change things here and there based on, the patient. Are they active? What's their lifestyle like? Is that we dealing with a couch potato who just snuggles on you and that's it? Or are we dealing with the athletic, agile patient who's running, chasing the balls and you can't get them to stop misbehaving and causing trouble? Overall, you want to look for the same principles along them. Basically, what you want to do is whatever their body weight is at about 1 year of age is a good ideal body weight for the rest of their adult life. There are some variances with that depending on the breed, but there's exceptions with every rule. Today, we're just kind of going off guidelines and basics. Typically, whatever they weigh at 1 year of age is what you want to shoot for. Depending on how big the dog is, we can add, 5%, maybe 10%, and that's probably about it. At home, what you guys want to look for is you want to keep them curvy. Male or female, keep them curvy. From the top, you want to be able to feel their ribs with light pressure. They should kind of feel like your back knuckles just a little bit. This much is probably too skinny. This is probably just about right. So light pressure, you should be able to feel the ribs, count them just a little bit. And even from a distance, you should be able to see a couple of ribs when they're turning and moving and doing their thing. As you move your way back from the ribs, they want to have that little bit of an indentation, kind of like a Coke bottle. You will have the top at the Coke bottle, and then as you go back, you have a little bit of curve, and then they go back out for the hips. So looking at the dog from the top, you really want to try and have that Coke bottle shape. That's an easy shape most people can recognize and be associated with, and that's what you want to shoot for. From the side, you have their chest, and as you work yourself back, you want to have what's called a tummy tuck. So you have the chest, and then it should go up just a little bit. They should have a curve. It should be curvy from the top, curvy from the bottom, and curves. If you start getting straight lines from the top and straight lines from the side, they're chunky and they got some extra love handles, and that's just what they are, okay? But some dogs are fluffy and you can't see those ribs. That's why you actually have to touch them and feel them and get an idea. Some owners will joke a lot and it's kind of funny. They're like, yeah, my Pomeranian's this big, but we went to the groomer and we got wet and then we were this big. And we just looked like a little rat. But, you want to keep those shapes and sizes in mind, and that's what we're kind of shooting for. And overall, that'll kind of keep you guys out of trouble for the most part. Another good tip is the manufacturers on your bags of dog food gave you a range. There's a reason they gave you that range. That is the ideal body weight for that size patient. So if you have a 10-pound dog, look at your bag of dog food. It should have a range for 5 to 10-pound dog. Feed for what they should weigh, not necessarily what they do weigh. Okay. And, other tweaks are for dealing with a couch potato or patient that really isn't active, or even just a patient that used to be but we're arthritic and we don't move around very much anymore. You want to keep an eye on them, but you want to feed them less instead of more overall, especially if they're a couch potato. If we're an agile patient who runs and jumps and is always checking the perimeter, has got to chase the mailman or whoever comes up, sometimes they're a little bit more active and they need some more calories because they're burning more calories. Sometimes for our geriatric patients, they will go through, a normal percentage of weight loss depending on their age, whether they're a cat or a dog. Most of our geriatrics we will consider seniors/geriatric patients, elderly patients, once they hit about 7-8 years of age. And you can transition them to a senior diet instead of the all-adult stages diet or a puppy diet, something like that. Once they get past about 7 or 8, transition them to a senior diet. And keep an eye on them. Any dramatic weight losses at once, touch base with your veterinarian. We definitely want to see them because there might be something else going on. Hope this helps you guys out a little bit, and we'll see you around. I'll be at Eastwood Animal Clinic. Our number is 915-593-0713. Take care, guys. Bye.